So our session, so this is the federal policy and program update session. During this session, we'll go in depth on recent federal policy changes that impact Texas healthcare and benefit programs. During this session, you'll gain insights into DACA eligibility, Medicaid and CHIP streamlining rules, as well as any significant changes that have been made to the ACA marketplace. We'll also cover navigator grant contracts and important regulations regarding agent broker consumer data handling. And we'll also explore the latest developments in federal mental health policies and programs. So to kick us off, we have our first speaker, Jessely Chavez, who is the Young Advocates Program Coordinator at Young Invincibles. And they're going to share their healthcare story. So Jessely, take it away.
Yes, good morning, everyone. I would like to thank everybody for, one, giving me the space to speak on behalf of my experience with healthcare coverage, but also just for being in this space. I know that if y'all are in this space, it's either because y'all are consistent advocates or interested in learning more. So thank y'all so much. So yes, thank you, Jada. My name is Jessely Chavez. I am born and raised in Houston, Texas. I'm now the Young Advocates Program Coordinator at Young Invincibles. And today I'm going to be giving y'all some insight into why healthcare coverage is so important to me. So my story with healthcare starts very, very early on. Up until the age of about 5 years old, I remember consistent doctor's visits, consistent emergency room visits. And that was all because I had severe asthma, so bad that, as my mother tells it, I would have asthma attacks consistently and have the paramedics need to be called in because my body simply could not, I wasn't able to respirate consistently. So those were very crucial years. Thankfully, at the time, we had Medicaid. My mom was a single mom with 3 daughters. And because of that Medicaid, I was able to stay up to date with all of my doctor's visits, get the medical care that I needed at the time, which was life-saving. And I remember, I don't know if this is only a Texas thing, but to enroll in classes, you have to have updated vaccination records. The school needs to have access to your medical records. And I remember that at the time, all of that was consistent. Then in about the 4th grade, I vividly remember that the doctor's visits were more scarce. All of a sudden, there was confusion every time the schools needed vaccination records from me. Anytime I had a fever or there was any sort of medical need, I had to rely on the school nurse, which was not adequate healthcare. And at the time, I didn't understand why we couldn't go to the doctor. It was like we kind of had to manage the severity of the case so that we could go to the doctor. And now I know that that's because our Medicaid had been revoked. My mom no longer qualified for Medicaid. This was a single mom, as I mentioned before, with 3 daughters working a minimum wage job at a grocery store. And it got to the point where she was having to choose between taking her kids to the doctor or getting them prepared for the upcoming school year with school supplies and mandatory school uniforms. And I don't think that any parent should ever have to be put in that position of having to pick a trade-off between which necessity is more important for their child. So we, like I said, there was less doctor's visits, and that's when I started to realize this consistent tension on my chest, and it just felt like I couldn't really control it's as if my mind was more in control of my body. And I didn't understand it at the time. And I tried to speak to it. I tried to speak about it with my parents and with my sisters, and nobody could really put a name to it. Now, fast forward 10 years, my mom is able to get healthcare coverage through her job. And I remember that that's one of the first things that she did when she got hired in this new position was ensure that she could get healthcare coverage for not only herself, but also her kids. And she was able to, thank God. And then the doctor's visits were consistent again. Now I can say openly, I'm able to go to any doctor that I need to go to because of this healthcare coverage. And more importantly, all that tension and all the stress that I felt was able to get a diagnosis because of mental health care resources. And I realized that I have been experiencing severe anxiety since the age of 10 years old. Because of that, because of my diagnosis, because of being able to speak about these things and realize the mechanisms and everything that will help me to live on a day-to-day life, I was able to speak with my family. And we realized that this might be a generational thing. My mom had been suffering similar symptoms for years and wasn't able to tell anybody because she also didn't have healthcare coverage, but now she does. And now we're all able to go to therapy together and we're all able to go to the doctors together. So I say this today just to speak to the life-changing impact that healthcare coverage has had on not only me, but my family, my community. And I ask all of us in this space today that for us to advocate for Medicare expansion, Medicaid expansion. If it's not already expanded in your state, it's not for Texas, in case you didn't know that. To advocate for that on the legislative behalf, but also being in these advocacy groups, having the potential, well, having the power to inform our networks of resources that are attainable for them and that are out there for them. And I just think that altogether, we can really amplify the necessity of healthcare and what medical healthcare coverage, like the drastic impacts that they can have on anyone's life. Thank y'all so much.
Thank you. Thank you so much, Jessely, for being willing to come on here and share your story with everyone. I know everyone here, this is not new for you and for the sister community, but thank you, Jessely, for sharing and being a true testament to the work that's being done. So thank you so much. Our next panelist is Ben Duvanzo, who is a senior health policy strategist at the National Immigration Law Center. He's speaking to doc eligibility for ACA coverage. Ben, if you want to go ahead, I'll click through your slides.
Thank you. So thank you to Every Texan and Young Invincibles for inviting me to speak. My name is Ben Duvanzo, and I am Senior Health Policy Strategist at the National Immigration Law Center. We are a national nonprofit advocacy organization and litigation organization devoted to improving the lives of low-income immigrants. I'm going to talk today about an exciting change and one of the largest expansions of federal healthcare coverage in recent years, the new policy making DACA recipients eligible for coverage under the Affordable Care Act. I'm first going to provide a reminder about the structure of immigrant eligibility overall for ACA coverage and how DACA recipients fit into it. I will then go into what the final rule from the Biden administration did and get into who DACA recipients are and the research we've done that sheds light into best practices for outreach and enrollment. Finally, I'll share what's next and how you all can engage. Next slide. While you all likely know this, the reality is a bit more complicated, but immigrants can be put into three groups for the purposes of public benefit eligibility. Next slide. The smallest circle, qualified immigrants, are eligible for means-tested benefit programs like Medicaid and includes green card holders with 5 years of presence, humanitarian immigrants, and others listed explicitly in statute. The middle circle, lawfully present immigrants, are generally people who are here with some kind of status or the government is aware of them. While they are, with some exceptions like kids in certain states, ineligible for programs like Medicaid and SNAP, they can receive ACA coverage. The largest circle encompasses all immigrants, including those without status. They are ineligible for most federal programs, though they can receive help from federally qualified health centers or emergency care in hospitals. Next slide. As a reminder, DACA stands for Deferred Action for Childhood Arrivals. It was established by the Obama administration in 2012 and serves people who came to the United States as children before 2007. does not provide permanent immigration status or a pathway to citizenship, but does address the fear of deportation for its recipients. It has been challenged in court, and its longer-term future is uncertain. When the Obama administration issued DACA, it said that DACA recipients would not be considered lawfully present for the purposes of the ACA, and established regulations stating as such. This was politically driven, and it was to try and avoid additional avenues of criticism for this new program. Slide 6. So in short, previous slide, please. In short, what the Biden administration did is move DACA recipients from the large circle to the middle one, removing that restriction. Next slide now, please. So to recap, the Affordable Care Act was written to be eligible for lawfully present immigrants. When DACA was created, the Obama administration removed them from that category, blocking them from the marketplace. In this spring, the Biden administration finalized regulations removing that restriction. Next slide. There is unfortunately one more development to keep in mind. This summer, attorneys general from Republican states, including Texas, led by Chris Kobach from Kansas, filed a lawsuit attempting to block this policy from moving forward, including a request for preliminary injunction. That has not been ruled on yet, and at NILC, we moved to intervene in this lawsuit on behalf of impacted DACA recipients and one of our community partners, CASA. We expect arguments in October, and we will need to keep in mind the chilling effect this legal case could have on enrollment and work to counteract it. That being said, to repeat, there has been no judicial ruling, and the policy is slated to move forward. Next slide. Just a quick overview of the rule itself. It removes the exclusion of DACA recipients from the list of lawfully present immigrants, making it clear that they are eligible for ACA marketplaces, including advanced premium tax credits and cost-sharing subsidies. While not the focus of this presentation, the rule also clarified or solidified eligibility for other groups of immigrants, including people with special immigrant juvenile status, people with employment authorization, and asylum seeker children. The rule did not finalize proposed changes to Medicaid eligibility for lawfully present immigrants. This means that in states like Texas, where lawfully present children are eligible for Medicaid, DACA recipients are not included, though at this point, there are a few DACA recipients young enough. It is worth remembering that under the ACA, people who earn less than 100% of the poverty level but are ineligible for Medicaid because of their immigration status can still get ACA subsidies. This applies to DACA recipients, and it is important to make sure that brokers, call center employees, and others that do not regularly work with immigrants keep this in mind. Changes are effective November 1st, meaning that DACA recipients will be eligible for a special enrollment period and can enroll in December coverage. Next slide. So who are DACA recipients? It is important to know to target outreach. Overall, there are over 500,000 DACA recipients. That number has stalled and started to shrink as new applications are paused due to litigation, and others have found pathways to more permanent immigration status. 88,000 live in Texas. While many DACA recipients are from Latin American countries, overall, they are from 100 different countries. DACA recipients can no longer really be called youth. Rather, they're now largely young adults, inching into middle age, and parents to tens of thousands of US-born children. Those on the younger side really fall into the Young Invincibles mindset and all the outreach challenges that come with it. Next slide. We lead an annual survey of DACA recipients with the Center for American Progress and United We Dream, and publish a report focusing on the health-related survey results of that survey. In fact, we just launched this year's survey outreach and would welcome help spreading the word. From last year's survey, we found that 1 in 5 DACA recipients are uninsured, though in past years, that's been as many as 1 in 3. Those with coverage largely get it from their employer. Unsurprisingly, this lack of coverage has led to consequences, such as a lack of access to mental health care or concerns around medical debt. Next slide. We asked about what kind of outreach they would want to see if they became eligible for coverage. Information about cost was the most important piece of information, followed by how to compare plans, and then immigration status related information. In terms of delivery, DACA recipients find government websites as the most important source of information, followed by informational videos and social media. Next slide. To follow up on these results, we partnered with Young Invincibles to hold a couple focus groups with DACA recipients in August. These groups confirmed the importance of sharing information from official government sources, something we have conveyed to federal agencies. In fact, DACA recipients said they would be suspicious of unverified ads or social media saying they could get low-cost healthcare, given how often they are the target of scams. At the same time, they use informal social media groups, often regional or based on school alumni, to share information and read updates. Outreach workers should work with their communities to identify which groups might be the most helpful. They also recommended partnering with local in-language media, like Spanish language television stations, which they and their families use to keep up on recent news. Finally, one of the biggest challenges will be helping people understand the importance of health insurance and navigate plan selection. Many felt that coverage would be either too expensive or cover too little, and felt it would be hard to compare plans by different costs. They felt they would need to be sold on why health insurance is worth going through the required paperwork and time. Next slide. So we are looking to November 1st and how we can prepare to make sure all DACA recipients are aware of their new health insurance options and assist in accessing them. We are leading a campaign to do that with Young Invincibles and United We Dream and invite you to join that. You can go to bit.ly, so bit.ly/ACADACA, bit.ly/ACADACA to join our campaign. We will need outreach messaging that includes some of the unique circumstances for DACA recipients, such as their ability to enroll in December coverage through a special enrollment period, or their access to help if they are very low income, even though they are not Medicaid eligible. We'll also need help and partnership in tracking barriers that come up. When the ACA had its first open enrollment period, immigrants in particular faced problems enrolling and still do, such as verifying their identity and immigration status. We will likely get a sense first from enrollment workers and community groups like you if DACA recipients are facing challenges and we need CMS to make adjustments. We're also very interested in connecting with DACA recipients who are enrolling for coverage, perhaps for the first time or for the first time in a while, and would love to connect with people who are experiencing this in order to connect with our broader advocacy and messaging. We'll also keep an eye on the lawsuit and provide information should there be any rulings that impact the program. Last slide. Overall, we are looking at this expansion of coverage as an exciting opportunity. With DACA recipients primarily made up of people of color, this is an opportunity to make a dent in racial disparities in health insurance enrollment and access to medical care. It'll take hard work to spread the word and provide the assistance, but I know that if you're attending this conference, you're already doing that hard work. I deeply appreciate your expertise and ability to help make this policy a success and the opportunity to provide some hopefully helpful information to facilitate doing so. Thank you.
Thank you. Thank you so much, Ben. We're going to open it up for questions. Let me go check and see if there were any questions. And if there are none now, please put them in the Q&A, and those questions will be saved and will be answered later through a form in a written format. Oh, we do have a question, Ben. So how do we know where to find DACA recipients to let them know? One second, it's coming in. To let them know about the new rule and coverage options.
So, right, DACA recipients are everywhere in our communities. They are working, but in particular, the ones that are working are more likely going to have employer-sponsored health insurance. So I would think about, in the way we are thinking about this, is there may be two groups of DACA recipients that are going to be most likely to be interested in ACA coverage. One is going to be students. So students either in undergraduate or grad school who may not have access to employer-sponsored insurance because they're students and their college's health plan is not good. That's going to be a really important population that would be interested in this coverage. The second group is people who are working or people who are unemployed and do not have access to employer-sponsored health insurance. We think this group is going to be one of the more challenging groups. Many DACA recipients are very active in communities, very active in advocacy. We work with them regularly, but those are the folks who are professionally employed generally and have access to employer-sponsored insurance. So we think it particularly using those social media methods that we mentioned, those informal groups like Facebook and Reddit, as well as working with college alumni groups, working with local faith institutions, working with local community groups are going to be the best pathways to identifying those people, DACA recipients who are past the age of being in college, but may not be working in a field that provides employer insurance or may not be employed themselves. I'd say the third area is also self-employed DACA recipients that are going to be a little more engaged in tracking this, people who might want to get health coverage, or people who might like to become self-employed. So think about small business owners or potential small business owners is another group to reach out to.
Thank you, Ben, for answering that question. If there are other questions, we will do that at the end of the session. But like I said, we'll also be sending out a form for you can send those questions in, and we can respond through the form. So thank you so much, Ben. Let me introduce our next panelist here, Lori Brown from CMS. They will be going over the 2024-2029 CMS navigators and CDOs contracts. So Lori, go ahead. Oh, I think you're muted. I think you're muted. It happens.
Thank you for that. It does happen. I'm so sorry. Good morning, all. My name is Lori Brown. I am a senior project officer at CMS, Centers for Medicaid and Medicare Services, which is part of CSG, Consumer Support Group, which manages the Navigator Grantee Program. Okay, so I don't have any slides, but I will talk briefly about what's going on regarding the new funding, new grantees, and new awards. Okay, so each year the CMS makes grant awards to organizations who serve as navigators in FFM states, which is the federally facilitated marketplace. On August 26th, CMS announced the award of $100 million in Navigator Cooperative Agreement Awards to 44 organizations serving in the 28 states that will have an FFM for plan year 2025. Now, keep in mind, the last grant period was a 3-year grant period, and we had 58 grantees with not that much funding. Now it's the opposite. We have a small number of grantees, 44, which will be receiving, which we have funded $100 million, but for the next 5 years instead of the 3 years, which equals out to $500 million. Okay. So 38 of the organizations selected for an award are current Navigator grantees. That's awesome because we got most of them back, some of them anyway. The 6 organizations are 5. There are 5 in FFM states that are new to the program. Okay, New Hampshire, Oklahoma, South Carolina, Utah, and none other than the Houston Food Bank, which is our new Texas grantee. Again, congratulations if you are present. So the period of performance starts August 27th through August 26, 2029. It's 5 years, okay? $500 million total to be awarded over the 5 years. So similar to previous multi-year project cycles, funding will be issued to recipients in 12-month funding increments known as budget periods. So the first budget period 1, will run from August 27th of this year to August 26th of next year, 2025, and thereafter, so on for the next 4 years. So unfortunately, some Texas grantees, our former ones, did not make it. They were not refunded. One of them was my grantee as a project officer, and I am sure they are continuing to do a successful job in their program without Navigator CMS funds. I also want to talk about briefly the CAC CDO program, Certified Application Counselors, Counselor Designated Organizations. Okay, this is not my program. I am not the POC, but the POC could not be here to present. She had schedule conflicts, so I am going to go over some things for her. There really aren't any real new updates regarding the CAC CDO program, but I will mention that the CDO application period is now year round and not just the annual once a year. So folks who are not yet CDOs can apply anytime. For the existing CDOs, the organizational maintenance web form was updated for easier use. We are now using DocuSign for agreements. So anyone who was set to renew their CDO agreement in 2024 will now renew in 2025. All renewals were pushed forward a year. So new renewal dates will be assigned later this fall. So if you have any questions, you can relate it to the CAT questions at cms.hhs.gov. Now, I know I'm saying that fast, but everything that I am mentioning, well, not everything, but more additional information regarding what I am presenting will be in the chat, the links, the inboxes, as such. So as far as the CAC program, CDO program, we host CDO office hours every Thursday for CDO leadership if you have any questions about your account with CMS or training. And the office hours are held again every other Thursday at 2 p.m. ET, that's Eastern Time Zone. Again, for further information regarding what I've stated on the Navigator Grantee Program, the awards, new awards, and the CAC CDO program, you can find links in the chat. If it's not there, it will be there. On the, again, this year's Navigator grantees, press release regarding that, and a list of the 2024 Navigator awardees that have actually made it. Again, thank you for inviting me. I appreciate presenting on this information. I wish you all well, especially those Texas Navigator grantees out there. Remember that OE is around the corner. Don't forget. Thank you.
Thank you. Thank you so much, Lori. Now we're gonna go to Q&A. If there are any questions, like Lori said, those links are in the chat for the NAV grantee program, as well as information regarding the CDO application. So if you need those will be linked in the chat. Let me check and see if we have any questions. And if not, like before, you can ask via the form, and we'll have those answers available for you then. I'm not seeing any questions. It looks like they were answered in the chat. Please click those links if you need them. Our next panelist, thank you so much, Lori, is Mina Schultz, who is the Health Policy and Advocacy Manager at Young Invincibles. Mina, go ahead.
Thanks, Jada, and thank you to our partners for having me here today to talk about some updates to the ACA that have happened over the year. Jada, do you have my slides?
Yes, they should be sharing now.
Okay, yeah, I see it now. So yeah, welcome everybody. I see some familiar names here, and congratulations, as Lori said, to all the Navigator grantees this year. Like I said, I'm going to do a little recap of the Affordable Care Act changes that have happened over the last year. As Ben mentioned, there is, can we go back one? There we go. Ben mentioned the ACA-DACA rule, which we're really excited about. I wanted to start by taking a step back and discussing the regulatory process that most of these updates I'm going to provide went through. So first, a federal agency proposes the rule, the policy. And then it goes through a comment period where advocates, the public, anyone who wants to can comment whether they agree with the rule, whether they disagree with the rule, whether they think there are changes that could make it better. And then the agency takes those comments and reviews them, and then proposes the final rule. So most of what I will be talking about today are finalized rules. Next slide, please. So the first one is one that we're very excited about. This was finalized, I believe, last spring, and it's with regards to short-term limited duration plans, or junk plans, as some people know them. We'll just call them short-term plans. So the last administration extended the amount of time that people could sign up for these plans. These are plans that are quite skinny. They don't have the protections of the ACA. They don't cover a lot of services, and there may be waiting periods to get those services. So what this rule did was bring that long extension of time that people can sign up for them back down to 4 months. So you can only get one of these plans for 4 months. That's a 3-month contract and the ability to extend for 1 month. And that went into effect on September 1st. So it's just started. It also changed the language, alerting consumers to the difference between these short-term plans and comprehensive coverage. The former notice read, "This is not qualifying health insurance that satisfies the health coverage requirement of the Affordable Care Act. If you don't have minimum essential coverage, you may owe an additional payment with your taxes." So it says that it doesn't satisfy health coverage requirements of the Affordable Care Act. But how many consumers really know off the top of their head what that means? So next slide, please. So this is the new notice that was in the finalized rule. You can see it's much more comprehensive. It lays out clearly what the short-term policy offers as far as benefits covered, that you don't get financial assistance with this option, and that it does not come with the protections of the ACA. On the other side, it describes what you can get if you sign up through healthcare.gov, which is protections for people with pre-existing conditions, a set of essential health benefits, and help with your out-of-pocket costs. It clearly lays out how to get coverage through healthcare.gov. You'll see the website and the phone number on there. And it just more clearly tells a consumer what they're signing up for if you're not reading the other fine print. So this was a very exciting development that we saw this last year. Next slide, please. The next one is the 2025 Notice of Benefit and Payment Parameters. These are what lay out the marketplace rules for the following year. So the first one, the NBPP is very extensive. I kind of just pulled out the parts that are more pertinent to outreach and enrollment work. So the first one is that it will allow states to add routine dental coverage as an essential health benefit, an EHB. That would begin starting on or after January 1st, 2020. So this is an option for states. It does not require states to do this by any means. And as far as I know, no states have suggested interest in this yet. I get the impression that they may be waiting for, other states to go first and try it out. As far as special enrollment periods go, this rule would make permanent the 150% federal poverty level special enrollment period. This is a year-round SEP for people with incomes under 150% FPL, which is great because sometimes they change their insurance a lot and it gives them the option to sign up year-round. It also will eliminate the 15th rule, which some of you may be familiar with. Plans selected after the 15th of the month will begin on the 1st of the month following enrollment in the plan. So very exciting. I know a lot of the sisters have dealt with that 15th rule for the last 11 years. So that's finally going to be a change. And then the last one shouldn't affect Texas too much. It actually only, off the top of my head, only affects one state. But as far as open enrollment dates, all open enrollments, including those in state-based marketplaces, must begin on November 1st and end no earlier than January 15th. I believe, again, there's one state that may have ended before January 15th. Next slide, please. This is a rule that I keep saying we're excited about. We're excited about all of them. This one was just finalized last week or the week before, after having been waiting in the regulatory comment period or finalization period for over a year. So we've been waiting for this final rule to be finalized for over almost a year. What it does is strengthens the Mental Health Parity and Addiction Equity Act of 2008. If you're familiar with that, that law said that mental health services need to be covered by insurance equal to what physical health services are covered. So you couldn't be paying more or have less access to mental health services than you could physical health with your insurance. That didn't really happen with that law. Insurance companies found a lot of loopholes, and this kind of shores some of those up. So first, it requires plans to make changes when they're providing inadequate access to mental health and substance use care. This includes things like how much they pay out of network providers and how often they require and also deny prior authorizations. The second thing it does is also around prior authorization. It means health plans cannot use more restrictive prior authorization or narrow networks to make it harder for people to access behavioral health services. So these rules really strengthen mental health parity. It kind of keeps health insurers in line and protects those who need mental health services from getting, long wait times for prior auth, having a hard time finding a provider, that sort of thing. Next slide, please. This one is not a finalized rule. This is just an update on something that we're monitoring and advocating for, and it's about enhanced premium tax credits, or PTCs. These are the enhanced subsidies, the tax credits, the financial help that were provided under the American Rescue Plan and extended under the Inflation Reduction Act. Those enhanced subsidies provided more financial help to more people who are buying their marketplace coverage and are set to expire at the end of next year. Now in Texas, about 95% of enrollees are receiving advanced premium tax credits and cost sharing reductions. They're receiving financial help. And the average premium after that financial help is about $33. Now, if these enhanced subsidies aren't extended past 2025, and we're advocating that they become permanent, folks are going to see their premiums skyrocket come 2026. And this is really urgent because insurers are starting to set their prices for 2026 already. It's coming down the chain. This is something that Congress needs to act on quickly. As far as Congress, there is a coalition-led effort to educate Hill staff on the consequences of allowing expiration. This means advocates are talking with members' staff to let them know exactly what the consequences will be for consumers if these are allowed to lapse at the end of 2025. There have been letters from Senator Shaheen and Representative Underwood calling on Senate and House leadership to take action. And in fact, just a recent development is tomorrow, the Senate is going to have a vote on the Healthcare Affordability Act, which sole purpose is to make these subsidies permanent. It's a very short bill. I think it's 2 pages. And it just says these subsidies will be made permanent. Now, this is not likely to go anywhere. It's just an opportunity for the Senate to hear that this is an issue and kind of get the conversation going and make it a placeholder for future legislation. Next slide, please.
And I just want to let you know, we have 2 or 3 minutes left. That's okay.
I'm right there, almost done. I think the next one's my last slide. Yeah. So why do these PTCs matter? So many people are benefiting across the country. 7.2 million more people will receive subsidized marketplace coverage with these subsidies relative to what it would be like without them. Additionally, there will be 4 million fewer uninsured people in 2025 thanks to these subsidies. And it's also an equity issue. First of all, people under 150% federal poverty level benefit most from these subsidies. They can find plans with very low cost sharing and even $0 premiums. With the enhanced subsidies, the enhanced PTCs, Black and Hispanic people will be enrolled in marketplace coverage at higher rates than white people in 2025. And they will also account for a larger share of marketplace enrollment in 2025 than they would have without the enhanced PTCs. And then lastly, Black and Hispanic people will see greater reductions in the percent of uninsured people relative to white people because of these enhanced subsidies. So Black and Hispanic folks and people of color more broadly are benefiting greatly from these subsidies. They're seeing their uninsured rates go down. More of them are getting coverage that is affordable to them. And it's really great to see this in action, what policy can do to lift people into healthcare affordability. Next slide, please. And that is all my updates. Just wanted to promote YI's summit that is coming up next Thursday. It's a half day. We invite you all to come. We have a few panels. It's really great for assisters to join. We'll have seasoned assisters there to talk about their experiences and share them directly with you. We'll have lots of opportunities to connect with each other, talk, and plan for open enrollment. So we hope you'll join us at that. It's going to be a good time, I think. So thank you, everybody.
Awesome. Thank you so much, Mina. We do have a couple of questions. I think we have time for one. So when will marketplace plans cover dental care in Texas?
When Texas decides it wants to. It is up to the state to decide if they want to make dental care for adults an essential health benefit. So hopefully we'll see it.
Okay, we can do one more. So for the mental health parity change, when will it be easier for people on Medicaid or marketplace health plans to find a therapist or counselor under their plan?
That rule, unfortunately, doesn't go into effect until 2027. So it will be at least until then. And then I'm sure there will probably be some growing pains, but hopefully 2027 and onward, we'll be seeing a little bit more parity for mental health.
All right. Well, thank you, Mina, for sharing and being a panelist. And if you'll have any more questions for Mina or for any of our previous panelists, please drop them in the chat. We are keeping track of those, and we'll be hopefully able to answer a little bit more at the end of this session. So thank you, Mina. Next up, we have Erin O'Malley, who is the Senior Policy Analyst at Every Texan on Medicaid and CHIP updates and streamlining rules. Erin, take it away.
Thank you, Jada. We can start with the next slide. So I'm going to be talking about a rule that's similar to what Mina was just talking about. It's a federal policy that the Centers for Medicare and Medicaid Services, CMS, proposed and then got through this approval process, and now it's policy for the entire country. So I'm going to give an overview of this rule, including what this is going to mean for Texas, when it's going to be implemented, and what things different community and advocacy groups can do to help support the Texas Health and Human Services Commission, or HHSC, in implementing this and getting the money that they need from the Texas legislature to implement it, so we can support our agency in this being successful. So we'll go to the next slide. So what we're talking about is that earlier this year, CMS, the Centers for Medicare and Medicaid Services, released a final rule that promotes streamlining the eligibility and enrollment process across state Medicaid programs. So we're going to give an overview of the rule, what it means for Texas, and then how, I said this last slide, I've given this one a lot. So we can go to the next slide. So first I want to talk about why this rule is necessary. State Medicaid programs are very different. Every state has its own Medicaid program, and it's a joint program between the federal government and the different states. So if you know one program, you only know one program well. This rule was an effort by CMS, both to standardize and modernize elements of the Medicaid and CHIP eligibility and enrollment systems across all 50 states. So before this, you had some states where they were doing one thing, and other states they were doing another thing. And now that we've had enough time to know what works best to get more people covered and to stay on coverage, and that's best for the state in terms of what it takes to keep the program going, they're trying to make things more standard across the 50 states. So most of this rule just makes mandatory processes that a majority of the states were already using, and it means that the rest of the states have to do what most of the states were already doing, if that makes sense. And the primary legal hook here, so why CMS has the authority to do this, is that they want to support the objective of the Medicaid program, which is health coverage, and making sure that the program's integrity, also, in addition to making sure that people are eligible for coverage, it ensures that systems promote enrollment for people who are eligible, instead of just focusing on, let's make people jump through all these hoops and get on the coverage. We want to make sure that the systems invite people who are eligible to actually get coverage. And we can go to the next slide. So we're going to go key provisions for Medicaid, CHIP, and then for dual eligibles on Medicare and Medicaid. The key provisions relating to Medicaid are, first of all, a specific procedure that state agencies must follow when mail is returned unopened. So if the agency sends out a notice of any kind, and it just comes back to them unopened. So this will require using the United States Postal Service change of address information. Currently, this is something that states, including Texas, have to have a waiver to do. They had to ask for permission for this, and now it's just something that all the states are going to be doing. There are also new requirements for what kinds of information and income data states have to use during the ex parte eligibility determinations. So the ex parte eligibility determinations are the ones that none of the assisters have to be a part of. It means that the information the state has is matched with information about the person who is applying for coverage, or the family or the household applying for coverage, and that the two sets of information are used to just get people enrolled in coverage, instead of a family or a person having to fill out paperwork or go through a process or show proof of income and that kind of thing. Texas has a very low rate of those types of eligibility determinations. We're usually around 4 or 5%, which is really, really bad. Some states up to almost 100%, not quite 100%, but almost like in the 90s, mid 90s, upper 90s, actually happen just on the computer, and no one has to submit an application in that same way. So there are going to be new requirements for what kinds of information all of the states and what kinds of income data all the states have to use. So hopefully this will improve Texas's ex parte or administrative eligibility determination rate. And sorry, I know these are a lot of big terms that aren't very fun to talk about, but they're really important for the people that we're all trying to get covered. This is very important for our enrollment assistance efforts. There are going to be longer response windows that Texans will now have. So they're going to have 15 days to respond to requests for more information. Currently, Texas only allows 10, so that extra 5 days should allow families more time to get the information they need and to respond to the state. And then 30 days to respond to requests for information when they are renewing coverage. So even longer when you're renewing than if you're just applying for the first time. There are other nitty-gritty policies relating to data storage and retention that a computer expert would be a better speaker on, but it goes into a lot of detail about best practices for how the states keep data, retain data, and use it to make sure people are covered. And we'll go to the next slide on CHIP. So the new rule eliminates any state CHIP policies, and CHIP is the Children's Health Insurance Program, as a reminder, that impose waiting periods before coverage begins, any lockouts from coverage for failure to pay premiums, and then any annual or lifetime limits on coverage. So this means that if you enroll in CHIP, you just get the coverage. You don't get locked out if you forget to pay your premium or if your parents do. And there aren't yearly or over the course of your enrollment limits on how much the plan will pay for your care. So some states had all of these policies, and it was very hard to use CHIP coverage. Very importantly, the rule also requires states to create, or if they have one, to fine tune in alignment with federal guidelines, policies that promote a more seamless transition between Medicaid and CHIP when income or other factors change. So we don't want a child who's enrolled on Medicaid, whose parents start to make more money, which is great, but they still qualify for CHIP, to just lose coverage. So we would ideally want the states to be making sure that those kids are identified and just transition to the appropriate type of coverage without the family having to apply or anything else, and no loss of coverage if we can help it. And we'll go to the next slide. So there are some provisions of the rule that relate to dual eligibles, and these are for people who are dually eligible, so eligible for both Medicaid and Medicare. These are non-MAGI coverage groups. So this is where income is not a factor for eligibility. The MAGI means modified adjusted gross income. And the rule eliminates interview requirements for these people. When they have multiple eligibility checks in a year, that's not allowed anymore, and waiting periods before coverage starts. And we'll go to the next slide. So what will Texas specifically need to change in order to implement this and be in compliance with the new federal law? Texas is going to have to take many steps to better streamline eligibility and enrollment process. The most apparent changes, so the ones that we'll all see pretty quickly, is getting rid of the 3-month waiting period before CHIP coverage starts, and then also allowing applicants longer response times when HHSC or the agency needs more information from them to confirm that they're eligible. HHSC has indicated that because some legislative involvement is required in order to amend state policies before they can implement these new requirements, the changes will not start until after our legislative session so around the summer of 2025. So for the states where they only have their legislature meet every other year or at a more kind of segmented interval than some states, they're just meeting all the time. They have a little bit longer runway when the agency needs legal authority from the legislature to implement changes. And I think it's also important to say that HHSC, so Texas's state agency that administers our Medicaid and CHIP programs, was really supportive of this rule. So they kind of the process that Mina talked about earlier, they wrote their own comments on what they thought about this rule. Most of the states did, probably all of them. And they were supportive of the rule and the provisions in it. And they did voice concerns over compliance requirements, including cost and timeline. So we are assuming that they're working with CMS on how that will work in Texas so that this is implemented and it's done in a way that the agency can handle. And the next slide. What will likely not change in Texas? We just wanted to flag that there are a few policies in our state that are not going to change because of this rule. Well, they're not going to change despite the fact that this rule happened, I guess. The rule doesn't impact them is the best way to say it. So there are a couple things that Texas does that are a little weird that do impact our ex parte or our administrative rate, meaning when the family doesn't have to submit pay stubs and that sort of thing. The biggest example of this is Texas policy where we only use income data that is 60 days old during the ex parte review of applications. This is not a federal requirement. It's not even really a state law. It's just something the agency does. It doesn't violate any laws or policies. We do believe, though, that it does impact because of how often the wage and income data is released between the agencies, that it is a big driver of our low ex parte rate, if that makes sense. So this is not going to change. We're going to have to work on that in the legislature. And then the next slide. So how can we support implementation? For those of us who do participate in or help other groups participate in the 2025 legislative session, just supporting any laws or any changes to state law that gives our state agency the ability to comply with this rule or to make our systems better, like any money for new computers. I'm sure all of us would love to see updates to tiers, updates to the 211 system. So we're going to be working on supporting efforts to better fund HHSC's overall eligibility and enrollment work, including, boring stuff like better computers, better software, really important stuff like more staffing. The agency did request more staffing again and some computer and system updates in their budget requests to the legislature. So this is also very important to them. And then we should support any administrative advocacy, which is the kind of commenting on proposed rules that the agency identifies as needed to make the agencies talk to each other a little bit better so that HHSC is getting the best possible information so that they can use that to determine eligibility so that the families can just apply for it, get on coverage and not have to, respond to a bunch of notices or provide a bunch of pay stubs, because families are not having to do that in a lot of other states now. And then the next slide.
I just want to flag, Erin, we have about 2 minutes. That's okay.
Okay, I think this is the last slide. All right, yes. So I'm going to put in the chat a blog that Every Texan wrote about this. It has a link to the federal rule if you'd like to look at the CMS fact sheet about that. But otherwise, I'll take a couple questions until Jada is ready to move on.
Yes, so we do have one question that hasn't been answered yet. So they say 15 days to a response day is still really quick. What can we do to make that window longer since it already takes like 7 or 8 days to get the letter to families in the first place?
Yeah, that's as complicated a question as it probably can be, even though it doesn't seem like it. Because there are some of the delay is related to the 15 days is the new federal standard. So we can't do a ton about that being what's required. I will look into whether Texas can make that longer. I assume they can. I'm not 100% sure, but we'll look into that and let you know. On the HHSC side, it is complicated because part of it is that the computers are just so bad right now. They're making all sorts of mistakes. They're not sending letters when they should. They're not sending letters to who they should be sending them to. So all of that complicates how quickly the turnaround time is going to be. So I think the answer to that question is pushing Texas to do as big of a response time as is allowed under federal law. In addition to that, making sure that the ex parte rate is as good as we can, because then they're not going to get requests for information very often. So again, in some states, only like 4 or 5% of all applications, they get any sort of request for any more information. The family applies and they use all the information they have, and then they're just enrolled. So it's kind of pushing so that we don't have to worry about the turnaround time anymore. But in the interim, certainly the different computer changes, and there's just a lot of different little pieces of policy at both the state and federal level that impact that turnaround time, unfortunately. So it's a lot of different things to work on. And we're trying to work on all of them in different coalition spaces and with different national partners too.
Right. Thank you, Erin. Thank you so much for those questions too. Like I've said before, if you have any more questions for Erin or our previous panelists, please keep dropping them in the chat. We're taking note, and we can answer those. So our last panelist for the federal policy and program session is Randy Moore. He is the policy manager at Active Minds, and they'll be speaking to mental health policy and program updates. So Randy, go ahead. I'll share your slides.
Thank you, Jada. Howdy, everyone. My name is Randy Moore, and I serve as the policy manager at Active Minds. And I'm honored to speak with you today about the critical need for federal action on youth mental health. We'll be exploring some of the most important federal initiatives that are being developed and implemented to address what is the escalating youth mental health crisis. The crisis has really become one of the defining public health issues of our time. And today I'll walk you through the scope of the problem, the federal government's response, and key legislative actions designed to provide long-term solutions. So I just want to introduce Active Minds to you all at the top of this presentation. Active Minds was founded in 2003 by Allison Malman when she was a junior at the University of Pennsylvania, after her brother Brian died by suicide following a battle with depression and psychosis. Allison realized that there was a major gap in how campuses and society at large talked about mental health. So she started what was initially a small group aimed at reducing the stigma around mental health and encouraged students to seek help early. Over the years, this initiative has grown into a national movement. We're in all 50 states and are now the leading nonprofit organization supporting mental health awareness and education for young adults aged 14 to 25. And our mission is clear: to change the conversation about mental health. We do this by providing education, resources, and training, and by empowering young people to lead the charge in breaking the stigma around mental health. And so in terms of our vision, we really envision a world where no one struggles alone and where mental health is seen as an essential part of overall well-being, and where people of all backgrounds have access to the support they need. And lastly, I'll note that, one of the most powerful aspects, I think, of our work is that it's grounded in lived and living experience. Many of our student leaders, chapter members, and advocates have personally experienced mental health challenges or have supported friends and loved ones who have struggled. So the work at Active Minds is closely tied to what's happening at the federal level. Federal policy can either be a barrier or a gateway to mental health services that young people need. So I want to talk somewhat about the prevalence of mental health disorders in youth. Currently, 1 in 5 adolescents in the United States, or approximately 25%, are experiencing a mental health disorder. And this could be depression, anxiety, ADHD, or another mental health condition. However, even though these challenges affect a large portion of our young people, we know that fewer than half of them, around 45%, are receiving the treatment they need. This treatment gap highlights significant barriers in access to care. Perhaps one of the most sobering statistics is that suicide has become the second leading cause of death for individuals aged 10 to 24 in the United States. And this statistic alone should be enough to prompt immediate and decisive action. The loss of even one young life to suicide is a tragedy. And the fact that so many young people are feeling hopeless or unsupported is something we must change as a society. So I want to talk a little bit about the impact of COVID-19. The COVID-19 pandemic has had a profound effect on youth mental health. Yep, sorry, same slide. Exacerbating many of the existing challenges. Studies show that rates of anxiety and depression among young people have risen sharply since the start of the pandemic. And for many young people, the pandemic has created a perfect storm. There was isolation from friends and family, uncertainty about the future, and major disruptions to education and social life. This isolation, caused by school closures and social distancing measures, severely impacted young people's ability to interact with their peers, a critical component of social and emotional development during adolescence. On top of that, the shift to virtual learning presented its own challenges, leading to increased stress, decreased motivation, and feelings of disconnection from the school community. So in response to the growing crisis, the federal government has started focusing more on increasing access to mental health services, particularly in schools and underserved communities. Recognizing that schools are one of the primary settings where young people can access mental health support, many initiatives have aimed to expand mental health resources within educational settings. The Biden administration, for example, has significantly increased funding for school-based mental health services and billions of dollars allocated to expanding mental health resources and professionals in schools through federal programs. And we've also seen action from Congress, which has also recognized the urgency of the issue with several key bills aimed at improving access to mental health care and reducing suicide rates among youth. You can go to the next slide. So in response to the alarming rise in mental health challenges among young people, the Biden administration has made youth mental health a key priority. Several new initiatives have been introduced to address gaps in mental health services and provide the resources necessary to support young people in their communities and schools. I want to highlight three critical components of the administration's response: the Youth Mental Health Corps, the expansion of school-based mental health services, and the significant funding made available through the American Rescue Plan. The Youth Mental Health Corps. So what is it? It's really one of the most exciting and impactful new programs, and it was launched in partnership with AmeriCorps. This initiative recruits young adults to serve as mental health navigators, offering peer-to-peer support in schools and communities with a special focus on underserved areas where mental health resources are often lacking. So peer support is something that's really important to us at Active Minds and is an incredibly powerful tool in addressing mental health, especially for young people who may feel more comfortable discussing their challenges with someone their own age. These navigators help to build the gap between students and the mental health services they need, providing immediate and culturally responsive support to their peers. This initiative is particularly focused on reaching students in underserved communities, places where mental health services are limited or unavailable. The Corps aims to ensure that no young person falls through the cracks simply because they lack access to resources. And the goal is not only to provide support, but also to normalize conversations about mental health in schools, reducing the stigma that prevents so many young people from seeking help. So in terms of school-based mental health services, really the Biden administration has made significant strides in expanding these services through the school-based mental health services initiative. The administration has allocated significant funding to expand these services in schools. This includes nearly $300 million secured through the FY 2022 bipartisan omnibus agreement and $1 billion over 5 years from the bipartisan Safer Communities Act. This initiative is part of a broader plan to double the number of mental health professionals in schools over the next few years. This includes counselors, social workers, and psychologists, all of whom play crucial roles in addressing mental health challenges at the school level. So two key programs supporting the expansion through these school-based mental health services are the School-Based Mental Health Services Program, and the Mental Health Services Professional Program. These programs are designed to provide resources needed to hire and train mental health professionals, ensuring that schools have the capacity to meet the growing mental health needs of their students. And this matters because for many students, school is the only place where they can access mental health services. Increasing the number of trained professionals in schools means that more students will be able to get the support they need when they need it. And research shows that early intervention, especially in the school setting, can prevent more severe mental health issues later in life, making this a critical area of focus. And then the American Rescue Plan, a significant part of the federal government's response to the mental health crisis, has been an allocation of $5 billion through the American Rescue Plan. These funds are being used to build a robust mental health infrastructure, one that can address both immediate crises and long-term mental health support needs. This funding is being used for a wide range of initiatives, from crisis intervention programs that help students in immediate need to long-term support services aimed at preventing mental health crises before they occur. So in summary, the Biden administration's response to the youth mental health crisis has been multifaceted, focusing on peer support through the Youth Mental Health Corps, expanding the mental health workforce in schools, and investing billions through the American Rescue Plan. These initiatives are critical in ensuring that every young person has access to mental health support they need, whether they are in school, at home, or in their community. So you can go to the next slide and we'll talk about congressional action on youth mental health. So while the Biden administration has taken significant steps forward in addressing the youth mental health crisis, Congress has also played a central role in advancing mental health services. The Bipartisan Safer Communities Act is one of the most substantial recent legislative efforts to support youth mental health. The act allocates $1 billion over 5 years specifically for mental health services in schools, which is a major win for students who rely on schools for mental health support. This funding is earmarked for a range of services, including hiring school counselors and social workers, and establishing new mental health programs and expanding access to mental health care education for both students and education. And then I also want to talk about a bill that passed recently called the Kids Online Safety Act. This bill aims to address a growing concern, which is the impact of harmful online content on youth mental health. As we know, young people spend a significant portion of their time, and unfortunately, this exposes them to content that promotes self-harm, eating disorders, and cyberbullying. With rates of cyberbullying and online harassment on the rise, this bill is critical for protecting young people's mental health in the digital space by regulating these online environments that young people engage with daily. And then I want to talk about two bills that have been introduced in the Senate briefly. The Strengthening Support for Youth Act, which would expand family and peer-based mental health services. This bill promotes community-level interventions that are especially crucial in underserved areas where access to mental health has been historically limited. and the other is the Prevention Services for Youth Act. This is another vital piece of legislation that places a strong emphasis on early intervention and preventative care and mental health, which is critical for identifying issues before they become more severe. And like I said, these have both been introduced in Congress on the side of the Senate. And we can go to the next slide.
Randy, I just want to give you, you have about 2 minutes.
Sure, I'll wrap it up. So I want to just touch on the 988 Suicide Crisis Lifeline. It's one of the most critical responses to the mental health crisis and launched in July of 2022. Since its launch, it's already provided immediate support to millions of individuals experiencing a mental health crisis. This service doesn't just handle emergencies, it also connects callers to longer-term mental health services and connect with local mental health care providers. And then Project Aware is another program which provides grant and state education agencies to state education agencies, helping them implement mental health awareness training for school personnel, including teachers, counselors, and school staff. And you can go to the next slide. So one of the things that's important is addressing the social determinants of mental health, which refer to the broader environmental and socioeconomic factors that shape youth mental health outcomes. And these include things like poverty, housing stability, educational opportunities, and community safety. And so recognizing that federal initiatives are increasingly aiming to address these broader systemic factors is important, and we need to continue to do so. And then last but not least, as we go to the next slide, as we conclude this presentation, it is important to recognize that youth mental health crisis requires a comprehensive and multifaceted approach, and no single solution will help solve the issue, but rather a combination of federal actions, legislative support, and community-based advocacy. So I can go to the last slide, which is just questions. If anyone has any, you can also reach out to me. If I can't answer a question in the moment, I'm happy to follow up with you via email and provide resources as available. So thank you.
Thank you so much, Randy. We do have a couple questions from the chat. So does Medicaid cover peer support services, or is there another application that assisters should be helping families fill out for peer supports?
That's actually a great question, and I would probably need to refer to my boss, who is the Chief Programs Officer at our organization, who's a little more in the weeds about the Medicaid side of things. I understand that there is movement being made in that regard, but I think it's, if I'm not mistaken, state by state, but I don't want to tell you the wrong thing. So I'm happy to follow up with that information with the folks on this, who leading this conference.
All right, thank you so much, Randy. We have time for one more question for you. So does Active Minds help families get mental health care supports in schools?
So we're more so focused on students through that peer-to-peer kind of programming. So the way it works is that a student can start an Active Minds chapter. They just need to get a sponsor from a teacher, and they can start this, what is a club, and basically host events on their campus, have meetings where they talk about youth mental health and really engage with one another. And then they connect with us at the national level, and we provide, support in terms of programming. We have an annual conference we do every year where many of those students come together, and we offer awards based on some of the work that they're doing. So I would say it's more focused on the student, but I would offer that we would provide resources when available if certain questions came up about potential families involved, but definitely more focused on the students themselves.
Okay, thank you. Thank you so much, Randy. That was extremely insightful. So that's the end of our session. I do want to ask every panelist a question. since we're a little tight on time and can't go through all of them. If there was one thing you want the sister community here to know about the upcoming coverage year, what would it be? And feel free, anybody who's on the panel, to come off mute and speak to that.
Thanks, Jada. And while panelists are thinking about the answer to that question, like what is a significant thing that you want sisters to know going into the recent coverage year, I just want to like pop in here that Medicaid does cover peer support services right now. It has since about 2019 in Texas. Provider reimbursement rates are generally low for the organizations that are kind of pairing kids up with their peers to work through mental health care programs and treatment options. So like with many things in Texas, it's tricky. So technically, yes, but effectively or functionally, oftentimes no. But I think that's a good topic for us to follow up on, maybe in a Get Covered Texas Coalition meeting. And we will totally do that. And we are running up on noon here. So if any panelists do have an answer to Jada's question, something that you were looking forward to. I think we can all reflect back on Ben's presentation maybe. I know Mina had to hop off also, but if any panelists do have thoughts, feel free to go ahead before I start the poll, actually before Emma starts the poll and before I start the raffle for the end of this session. So Randy, Aaron, Ben, if y'all are left here, any parting words or things looking forward to for 2025?
I would just say, recognizing, some of those stats I kind of shared at the beginning of this presentation, really we're seeing youth mental health being elevated as an issue in a bipartisan way, at least from the conversations I've had on the Hill, and that's exciting. And so, just recognizing that this is a growing issue and that, we all play a part in that process of addressing it. And so, just keep your eye on that issue as the year progresses. So thank you.
Thanks so much, Randy. Jada, if you would stop sharing your screen and I will start sharing mine. And Randy, I also just want to highlight another question that we got in the chat for you, which is from a person who is working in the Hays County School District in between San Antonio and Austin. And this person is wondering if Active Minds partners with schools ever, in addition to families. So I'm going to put you and that question asker together in an email chain, if that feels okay, and let you guys follow up with each other and see what kinds of supports Active Minds can give to school districts.
Happy to do so. Thank you.
Awesome. Thanks, Randy. Okay, I will share my screen and we will pop off to lunch in 3 minutes here as soon as I get this website pulled up. There we go. All right. Okay, so same list as before, totally random. I don't know if people can win twice, but we'll go ahead. So what I'm going to do is I'm going to spin the wheel, and then for folks who are here, if your name pops up, I'm going to give you about 30 seconds to raise your hand, or otherwise let me know that you are here, and then you'll win the gift card. And we'll do 2 at the end of each session, like I mentioned. So I'll just spin it right now.
Hey, Lynn, can we run the poll too simultaneously?
Yes, thank you, Emma. If you could start the poll. So there's the poll up on the top of the page here. So while folks are filling out that poll, we have a winner, Rebecca Rentana. If Rebecca is here, raise your hand. Or let me see, I'm looking at the chat. Let me get to the participants list. Okay, I see one person named Susan has their hand raised. Let me see if Rebecca's in the list. No, Rebecca Vela is in the list. And Michelle Hunter. Okay, cool. I'm going to spin this one more time. It looks like Rebecca Rentana is not here, but that's okay. We'll get to somebody who is here. Oh, Mary Lou said the poll is gone. Mina, sorry, not Mina. Emma, could you launch that again? And that looks like Jeanette Deep, maybe. Hang on. Yep, Jeanette Deep. And I'm not sure if Jeanette is here either. Jeanette is also one of our panelists for today. No, Jeanette's not here. Okay. We'll do this a few more times. There's like 180 people here, y'all. It's a lot. It's exciting. So we'll get to somebody. And y'all can't hear the sound effects. Oh, only I can hear those, but it sounds like a wheel is spinning. All right, and we've got Mercedes Lopez. Is Mercedes here? No, it doesn't look like Mercedes is here either. That's okay. We'll just keep going. This will take a couple of minutes, y'all. We'll try to get to the end of the panels a little bit quicker. And does that say Daniel? No, Nathaniel Chevalier. Okay, cool. All right, we got a winner. Nathaniel Chevalier, thank you so much. I'll be sure to send you a virtual gift card for $50. And congratulations.
Yeah.
And thanks for that. And let's, yeah, totally. That's exciting. And we've got one more for the end of the session. Let's see who's here. Patricia Gresham. No, Patricia's not in the room. I have a little search function that I didn't know was there earlier, so I'm just using that. We'll close, go one more time. Fingers crossed this person is here.
She said my name right.
Did I?
I'm sorry.
Sorry. Jade Little. Let's see if Jade is here. Nope, we'll keep going. I feel like I should have some Wheel of Fortune music in the background. Remy Parker. Remy, if you're here, raise your hand. All right, Remy's here. Cool. Okay, well, Nathaniel Chevalier and Remy Parker, congratulations, are session 2 gift card winners. We will see everybody back at 1 p.m. If you're available. We'll be doing Texas specific programs and policy updates at that point. Yeah, it'll be a great panel as well. Thanks again. And then our closeout panel today will be with former Texas Community Partner Program and Navigator Program Manager Ariana Anaya, who will do marketplace application tips and